After 10 years of helping people with Meniere's disease, this is what I've learned. For many people with Meniere's disease, they'll associate this with some of the most common symptoms. Symptoms like dizziness, hearing loss, ringing in the ear, or feelings of fullness in the ear. But the truth is that for many people, it's not quite this clear cut. For many people, it's not going to be exactly these symptoms, and it's not going to present in exactly the same way. And this is why they get confused when they go to see a GP or see a doctor or another practitioner, and they may say, okay, it's kind of close, but it's not exactly. The truth is that for all of us, for any condition, it's not always going to be like a textbook. There can be some cases where it has a bit of some aspects of the symptoms and some of the signs, but not all aspects. Another common finding I have for patients with Meniere's disease is usually it starts something more subtle. For some people, this may be, say, some motion sickness. This may be a history of finding it difficult to ride in cars. For some people, it may be that this loss of hearing in their ear may start on one side. It may start very, very softly. It may not start completely like they've lost all their hearing on one side. It also may start sometimes with some stiffness in the neck. Sometimes it may be mild headaches. Sometimes these can be precursors before it happens. And in a lot of cases of Meniere's, there will be some sort of injury that happens in the past, with some studies suggesting that up to 75 or 80% of people will have had some sort of head or neck injury in the past, which may precipitate and happen before they start to get these Meniere's symptoms. Another thing I've learned is that even though ENTs can be very, very helpful when it comes to Meniere's, and in cases where they have injections, they have medication, it can also be very helpful, unfortunately there's many cases where it isn't quite as successful. And that's where here in the practice, here at Vitality Chiropractic, we see a lot of these cases where someone has tried medication, they've tried other interventions, and it hasn't been successful. And this is where we do our best to try and give them more positive change for the future. Drop a comment below if you or someone you love experiences those symptoms of Meniere's disease.